Today we are starting brainstem. There are three parts of brainstem. This is midbrain, this is pons, and this is medulla. Now this brainstem is resting on clavus. Clavus is the inner part of the body of occiput. So this is resting, this anterior part of brainstem is resting on clavus, and posteriorly brainstem is related to cerebellum. Okay. Now today we will discuss the anterior part of the anterior external features of medulla as well as posterior external features of the medulla. Now this, if you see, this is medulla. Here there will be two vertebral arteries which will be joining and forming the basilar artery, which will run in this sulcus over the pons. Okay. Now coming to the external features of medulla on the anterior side, in the center you can note this is anterior median fissure. At the junction of anterior median fissure with the lower border of pons, there is a depression called as foramen cecum. Okay. If you go laterally from the anterior median fissure, there is anterolateral fissure. Okay. And if you go more laterally, there is posterolateral fissure. Now the elevation which you can see between the anterior median fissure and the anterolateral fissure is called as pyramid. This is pyramid. And the elevation between anterolateral and the posterolateral fissure is called as olive. This is olive. So sometimes this anterolateral fissure is also called as pre-olivary sulcus, and posterolateral is also called as post-olivary sulcus. Okay. Now this anterior median fissure on the anterior side of medulla is continuous below with the anterior median fissure of the spinal cord. Okay. Now this is pyramid, this is olive. You can note the rootlets here, nerve rootlets coming out from the anterolateral sulcus. These are the nerve rootlets of hypoglossal nerve. And this anterolateral sulcus lower down is continuous in the spinal cord also. So this, from where the hypoglossal nerve rootlets are coming out in the spinal cord, this sulcus gives rise to the ventral horn of the spinal nerve, or the ventral rootlets of the spinal nerve. Okay. Now if you go behind the olive, again you can see rootlets. Okay. So behind the olive in the posterolateral sulcus, there is emergence of three nerves, 9th, 10th and 11th nerve, that is glossopharyngeal, vagus and spinal accessory nerve. That is the cranial part of spinal accessory nerve. Okay, from here, just lateral to the olive. Okay, so 9th, 10th and 11th nerve from the posterolateral sulcus, and this posterolateral sulcus in the spinal cord gives rise to the dorsal horn of spinal nerve. Okay, so we had seen pyramid, hypoglossal nerve, olives, 9th, 10th, 11th nerve. Okay, if you go more laterally, here is the inferior cerebellar peduncle. Now what is inferior cerebellar peduncle? It connects the medulla with the cerebellum. We know posteriorly this brainstem is related to cerebellum. Now medulla is connected with the cerebellum through inferior cerebellar peduncle. Pons is connected with the cerebellum through the middle cerebellar peduncle, and midbrain is connected with the cerebellum through the superior cerebellar peduncle. Okay, so here is the inferior cerebellar peduncle. So these were the features on the anterior side. Also we should note that this is pontomedullary junction. So what is the extent of medulla anteriorly is from the lower border of lower border of pons to the superior border of the exit of the ventral horn of first cervical nerve. Okay, up till that the medulla is there. Up to the exit of C1 nerve below to the pontomedullary junction or the lower border of pons above. This is medulla anteriorly. Okay. Also at the pontomedullary junction, there are three nerves coming out. From medial to lateral, there will be 6th, 7th and 8th nerve. So at the junction of lower border of pons with the pyramid, there is emergence of 6th nerve, that is abducens. At the junction of lower border of pons and olives, there is emergence of 7th nerve in the form of two roots, motor and sensory. The motor root of facial nerve is medial to the sensory root of facial nerve. Okay, and more laterally there is between the inferior cerebellar peduncle and lower border of pons. You can see this is the vestibulocochlear nerve, 8th nerve. So medial to lateral at the pontomedullary junction there is 6th, 7th and 8th nerve. Okay. Now coming to the dorsal side. This is the dorsal view. Dorsal view of medulla oblongata. Now on the posterior side of medulla oblongata there are two parts, closed part and open part, because the upper open part of the medulla oblongata on the posterior side contributes in the floor of fourth ventricle. Okay, so this is the open part in the upper side and this is the closed part. This closed part encloses the central canal. Okay, now first we will see the extent of medulla on the posterior side. So in this specimen you can nicely see this is stria medullaris, okay, which is in the floor of fourth ventricle. So superiorly the posterior extent of the medulla is marked by stria medullaris. Inferiorly again up to the exit of the C1 nerve. Okay, that is the extent of medulla posteriorly. Now we will see the closed part, features on the closed part of medulla oblongata. If you see, this is the posterior median sulcus. Just lateral to it you can see a slight elevation is there. This elevation is gracile fasciculus. This is gracile fasciculus and lateral to it is cuneate fasciculus. Okay, so this is gracile tubercle, below which lies the gracile nucleus, cuneate tubercle, below which lies the cuneate nucleus. Okay, more laterally you can see here is the elevation, that is tuber cinereum, which is because of underlying spinal nucleus of trigeminal nerve. Okay, this is tuber cinereum. So fasciculus gracilis and gracile tubercle, fasciculus cuneatus, cuneate tubercle and tuber cinereum are the features on the posterior surface of the closed part of medulla. Now coming to the open part of medulla on the posterior side. We know it is limited superiorly by the stria medullaris. Now further there is sulcus limitans. You can see sulcus limitans in this. Can you see, this is the median sulcus. Lateral to it there is sulcus limitans. Okay, and there is elevation here which forms the hypoglossal triangle. More lateral to sulcus limitans there is vestibular area. In the lower part there is vagal triangle, area postrema. So if you see this area, this part of the lower of fourth ventricle in the lower part, which corresponds to the dorsal surface of medulla, this looks like a tip of an ink pen. So this is called as calamus scriptorius. Okay, so details we will be studying in the diagram, but just see, if you see this, you can, it is resembling the tip of an ink pen, which is called as calamus scriptorius. So that is why this part is also called as calamus scriptorius. Thank you.